Hi, this is Dr. Wade Binley again, founder and clinic director of the IV Solutions Method, a comprehensive functional healthcare delivery system. Today we're talking about phase 4 detoxification, the deep dive into detoxification. Once again, this is not your typical 3-day, 7-day, 10-day, 21-day detoxification system. This is this transformational detoxification system that's changing your life, overcoming chronic disease. You see, like I said before, toxic accumulation or toxic load is one of the 6 root causes of chronic disease. And in phase 4, we really get to the bottom line interface between the root cause disease system, because these toxins are actually inside of our cells creating havoc within the cell tissues. The cells have organs, and these toxins interface and interfere with the function of these organ systems. So what happens during this phase? Well, we've prepared ourselves beautifully because we've got our liver and bile and our digestive system working so well that we're eliminating 2 to 3 times a day, probably up to 3 to 4 months by now. Our microbiome is healthy and robust. Our liver is clean. It's prepared for this. Our kidneys are strong and healthy. Our organ systems are all healthy as well because we supported them with proper nutrition specifically for your needs. Our circulation, our blood, our lymph, our lymphatic system, our interstitial space are just waiting for those toxins to come out of the organs and from the cells of the organs so that they can pass them to the liver, into the bile, out into the gallbladder, then into the colon and back out of the body without compromising the function of our kidneys, our lung tissue, and our skin. The most important thing is that we've got the groundwork already ready in play, and now it's time to pull these toxins out. So what kind of toxins are we looking at here? Well, we're looking at mold toxins, we're looking at microbial toxins, we're looking at heavy metals, we're looking at industrial toxins such as solvents, we're looking at industrial agricultural toxins like glyphosate, pesticides, fungicides, herbicides. All these things are bioaccumulated, and they're in our cells interfacing with the potential for those cells to work. We have 10 trillion cells. Those 10 trillion cells over time become less functioning, and then we begin a disease process. So this is very, very specific too to the needs of a person. Some people have more tendency towards cardiovascular disease. Some people have more tendency towards neurological diseases. And some people have more tendencies towards skin eruptions. These are very, very important things to understand and discern when you're doing a detoxification. You see, the medical model doesn't allow for the value in the detoxification systems. They kind of throw it out with, like the baby with the bathwater, but in functional healthcare, we really strive to find out root causes. And this is one of the 6 causes, is bioaccumulation of toxins. So in this phase then, we're finally getting down to the nitty gritty here. We have prepared this pathway of elimination, and now we get to pull them out. So we have to be extremely careful as well, because there are certain things that we do specifically for what your needs are. So we've tested for all these metals, we've tested for these mold toxins, we know how much solvents in the industry that you've had, we know if you're glyphosate sensitive, we know all these things before we go. We don't guess, we test for these so that you actually know what you're getting into. This is a huge undertaking for a patient. And the patients must understand that now is the time to go for it. You're hitting the finish line here. And this is done about once every 4 to 5 years. It takes about sometimes up to 6 months to 9 months to get all the toxins out of your body so that you're clear. So what's going to happen, and which is interesting, is that your body will get rid of these toxins, and then you begin to self-adjust, and then your cells and your collective tissues will be healthier. That's the goal of detoxification, and there's nothing more I've never seen. When I used to work in a clinic in Mexico, I worked in a cancer clinic, and the process of healing it's a beautiful thing. in the beginning phases of healing from these terminally ill conditions, they have to detoxify first. And when they do, their body works better. There's no pain. There's no joint stiffness. Their brain is clear. They become more available for a spiritual transformation. Having said that, the goal of health, in my opinion, is to protect yourself from the environment so that you can manifest your own purpose of living. Now, if you're letting toxins get in the way of this, and you're not accustomed to having a detoxification system and plan, then I want to see you as a patient. I want to hold your hand during this process, like I did 40 years ago working in a medical clinic in Mexico, knowing the benefits of detoxification and the impact it has on one's life. So more details about detoxification can come to you individually. So I'm going to suggest to you, if you're interested in detoxification, consulting with someone like myself, consulting with me. We have discovery appointments, 15 to 20 minute appointments to discuss your personal needs. And then, if we're a good fit, you can set up for an hour and 20 minute physical exam and history so I can get to meet you in person. We also do virtual appointments as well. And if you're just that person who really wants to optimize their health and you're on a health grade of health that's high, but you want to maintain it and maybe improve it a little bit, like I see a lot of these types of patients here, and they just want to run through the system. They want to get to know what they can do to improve their health. And that's what we can do for you as well. Thank you for listening to the 4 phases of detoxification. My name is Dr. Wade Binley, founder and clinic director of the IB Solutions Method.